Seeing quorum, we will call our meeting to order. This is meeting number 67 of the Standing Committee on Health. We're doing our study on C45 on cannabis, and today our panel is focused on prevention, treatment, and low-risk use. And I welcome all of our guests by video conference and here at the table. As individuals, we have here today Michael DeVilliers, Assistant Professor, Policy Analyst at McMaster University, Mark Kleiman, Professor at Public Policy, Marion Institute of Urban Management in New York University by video conference. Welcome. From the Canadian Nurses Association, we have Dr. Lynda Balneaves, a registered nurse and medical and non-medical cannabis researcher, and Karey Shuhendler, Policy Advisor, Policy Advocacy and Strategy. From the New Brunswick Medical Society, we have Dr. Serge Melanson by video conference from Moncton. And from Nova Scotia Department of Health and Wellness, we have Dr. Robert Strang, Chief Medical Officer of Health by video conference from Halifax. So thanks very much. And we'll start with 10-minute introduction remarks by each organization. And then we'll go to questions from the members. So we'll start with the Canadian Nurses Association. Dr. Balneaves.
Actually, Karey will be starting our presentation today. Thanks.
Okay.
Thank you. Thank you, Mr. Chair. Good morning, Mr. Chair and members of the committee. My name is Karey Shuhendler, and I'm a registered nurse and policy advisor for the Canadian Nurses Association, the national professional voice representing more than 139,000 registered nurses and nurse practitioners. I'm pleased to be here today with Professor Lynda Balneaves, registered nurse and medical and non-medical cannabis researcher, who will be able to answer questions that are more technical in nature. Dr. Balneaves currently serves as an associate professor in the Rady Faculty of Health Sciences College of Nursing at the University of Manitoba and is a nursing leader in the fields of shared treatment decision-making, complementary and integrative healthcare. She has published and presented on topics related to knowledge translation, integrative oncology, treatment decision-making, and medical and non-medical cannabis. At the outset, I would like to thank the committee for studying this important issue and for inviting CNA to provide its recommendations. Legalization of non-medical cannabis will impact public health and as such requires a preventative approach to reduce the risks of health risks and social harms associated with cannabis use. CNA welcomes the federal government's work to table Bill C45, which will guide the legalization, regulation, and restriction of access for non-medical cannabis. CNA supports the passing of the bill and believes that legalization is an excellent option for addressing the harms of cannabis. CNA recently conducted a national survey of nurses to assess the readiness for legalization, determine knowledge gaps, and resources needed to collect input on the sections of Bill C45 that pertains to the scope of CNA's work. While the 2-month survey remains open until tomorrow, preliminary results indicate that a majority of nurse respondents favor the government's move toward legalization and that the focus should be on preventing access and associated harms for young persons through a variety of mechanisms, including considerations around packaging, labeling, display, promotion, and sale of cannabis and cannabis accessories. Legalization can support the regulation of quality, dose, and potency while minimizing social harms as well as the costs of prohibition. In addition, legalization can improve access to research into potential harms or medical benefits. In reviewing the bill, CNA was pleased with the moderate public health approach taken on the complex issue of cannabis legalization. In its current form, Bill C45 promotes the removal of harms associated with the prohibition model while recognizing the need to protect vulnerable populations, including youth. CNA has provided 4 recommendations for amending the proposed legislation, all of which are outlined in our brief. We encourage the committee to include all of CNA's recommendations in your final report, including those related to the sale and promotion of cannabis and cannabis accessories, and considerations around promotion and use related to alcohol. Cannabis should not be treated the same as alcohol. Harms of alcohol use and current alcohol policy can be downplayed at times and should not necessarily serve as the model for cannabis policy simply because it's one that is already established. Additionally, cannabis is different in that there are therapeutic indications and particular formulations for medical use. Thus, medical access should not be forgotten in the wake of legalization. While these other recommendations are not the focus of our presentation today, we would be pleased to answer any questions on the full range of recommendations put forth in our brief. This morning, we'd like to focus on 2 of the 4 recommendations, namely those related to youth criminal penalties and the inclusion of a comprehensive public health approach to legalization of non-medical cannabis. Our first recommendation regarding youth criminal penalties is specific to Section 8 and related subsections that state For a young person, aged 12 to 18, to possess cannabis of one or more classes of cannabis, the total amount of which, as determined in accordance with Schedule 3, is equivalent to more than 5 grams of dried cannabis, is guilty of an indictable offense and is liable and/or is guilty of an offense punishable on summary conviction and is liable to a youth sentence under the Youth Criminal Justice Act. A criminal record can not only limit an individual's ability to travel to certain countries, it can also lend itself to considerable social harms. In particular, for youth, a criminal record can be a barrier to volunteer opportunities, which are often required by school curriculums and can play a role in scholarship decisions. A criminal record can also reduce career opportunities and contribute to poverty and poor health outcomes. Legalizing cannabis while maintaining criminal penalties for youth can disproportionately disadvantage young people, particularly those from marginalized or racialized communities, potentially barring them from opportunities to equitably advance and contribute in our society. Given evidence that 21% of 15 to 19-year-olds in Canada have used cannabis in the past year, such legislation could potentially impact a large number of youths. Alternatives to a traditional punitive approach to addressing both minor crime as well as problematic substance use have demonstrated success. Examples such as drug courts, which use a restorative justice approach, offer an alternative to traditional justice processes. These models offer full engagement and accountability of the offender and help to address the broader range of contributing issues such as poverty, health, or social justice issues which may have brought the person to commit the offense in the first place. Consider a 15-year-old struggling with problematic cannabis use, caught possessing more than 5 grams for personal use. He uses non-medical cannabis to self-medicate for undiagnosed anxiety and depression, which is exacerbated by the stress associated with living in poverty. Would criminalizing possession or even a significant fine help this teen? Or would he be better served through a drug court system with a restorative approach where the teen can be accountable in his own healing, provided with opportunities to link with health and social service organizations to address the root causes of poverty, and treatment services to address undiagnosed mental health and substance use issues? With this in mind, CNA recommends that youth possession of cannabis not be subject to criminal penalties, that the government use a restorative justice approach as the guiding principle for addressing youth possession, and that such depenalization eliminate current or future repercussions for youth by removing the provision under Section 8 and related subsections of the Cannabis Act. Our second recommendation is for the government's investment in a public health approach to cannabis, including a comprehensive public education program. CNA strongly supports the recommendations made to the Federal Task Force on Legalization, Regulation, and Restriction of Access to Cannabis to learn from other jurisdictions, such as Colorado and Washington, and invest in a comprehensive public health and public education program, including those related to cannabis use while driving, well in advance of legalization. Canada spends more than $1 billion annually to enforce cannabis possession laws, arresting about 60,000 Canadians for simple possession. And this accounts for about 3% of all arrests. Legalization should remove significant social harms, but also remove the financial costs associated with enforcement under the current model of prohibition. And thus, with this in mind, CNA recommends that once legalization is in place, the government use a portion of the savings from enforcement and/or revenue from sales to invest in initiatives that contribute to positive health and social outcomes. Such investments should include tools, training, and guidelines to support public education programs for cannabis harm reduction strategies, programs for substance use prevention and treatment, and research to better understand the harms of non-medical use as well as the potential benefits of medical use. Cost estimates for these measures can be derived from jurisdictions where cannabis has already been legalized, from public education programs that have been launched, and from current federal government investments in public education related to tobacco use. Nurses are the largest group of healthcare providers in the country and often a person's first point of contact with the healthcare system. As such, nurses are well positioned to contribute to the development and delivery of this kind of health education. Results of a Nanos research poll commissioned by CNA in August of this year, which will be tabled, note that more than 9 out of 10 Canadians support or somewhat support nurses educating Canadians on the risks associated with non-medical cannabis use. Preliminary results of CNA's national survey of nurses noted that 49% of respondents indicated that they felt comfortable initiating a conversation or responding to patient concerns about the risks associated with non-medical cannabis use. Based on these results, CNA is committed to providing additional educational resources on non-medical cannabis to support nurses caring for people across the continuum of care. I would like to close by emphasizing that legalization of cannabis is an excellent opportunity to reduce harms associated with non-medical cannabis use, but we must get this right. CNA encourages the committee to urge the federal government to incorporate all of the recommendations put forward by CNA. Thank you.
And thank you very much for your contribution.
J'aimerais ça vous entendre sur l'âge et sur les conséquences et la logique, entre autres, là, de l'âge. Alors, Madame les infirmières ou Monsieur de Villiers ou les autres.
Thank you for the question. The Canadian Nurses Association approaches the question of age from a harm reduction perspective. So all of the things that have been discussed over the multiple days that we've been hearing, we feel that they all need to be very carefully balanced. We do recognize that brain development continues to occur until age 25, according to the research, and that there are harms associated with cannabis use. But as we've heard just now and throughout the preceding days, we recognize that setting an age too high could continue to leave Canada's, the people in Canada who use cannabis the most at highest risk from harms of the illicit market, and that includes crime associated with purchasing in an illegal market. It includes harms associated from an unregulated product where you don't know the potency, you don't know what the safety of what's in there. So we really think that the emphasis needs to be, instead of on an age itself, educating all members of the population, especially vulnerable people or potentially highest users, by developing education involving all stakeholders so that you can have a conversation with youth, so that it's not a paternalistic approach, so that they know of the harms and can make an informed decision.
And just adding to that, you know, it's well established, the stats are well known that Canada youth are among the most prevalent users of cannabis around the world. And by us raising the age, we're potentially keeping their cannabis use still a very hidden, in the shadows, health behavior. We need to be able to have youth be able to go to health professionals and be able to talk about their use, be able to talk about the problems associated with it, and to receive the appropriate education and the referrals to harm reduction programs in order to address problematic use. We also need to be able to kind of open the dialogue with our youth about the potential harms, many that they may not be aware of. We've seen research that suggests that many youth begin to use cannabis in social settings. They see it as almost a social lubricant. They don't associate harms with it, and they may not be aware of what the long-term harms are related to career and education attainment, as well as the cognitive development issues and the mental health issues that have been raised by other panelists today. So we need to make sure that we're opening that dialogue and we're being respectful of youth's ability to make decisions around their healthcare behavior.
I would say, picking up on one of your points, potency has been raised as a big concern. The cannabis of today is much more potent than previously. And I think it was the Nurses Society that said they wanted to see really good control over the quality, the dose, and the potency that people are getting. And so another way of protecting the public from things that are not well controlled is to get rid of one of the suggestions that's in C45, which is to allow home grow. Home grow has absolutely no quality control on the product, on the potency, on any of these things, and also provides easier access to children. So I wonder if the Nurses Association would like to start, and then we'll let everyone comment on whether they think allowing home grow is a good idea.
I think the risks posed by homegrown cannabis mirror some of the risks that we have associated to access to alcohol, tobacco, and pharmaceutical drugs in the home. And again, it really points to the need for public education related to the potential harms of cannabis, particularly to children that may consume it, not being aware of those risks. And I think it really points to the need for regulation around self-produced cannabis in terms of the source plants or seeds that will be used as a way of limiting potency, limiting the number of plants and plant material that is available within the home, as well as ensuring that there's regulation related to storage, labeling, and the use of that product in an edible form that may be, again, more attractive to children. So we support regulations related to safe storage and production. And again, it supports the need for open and non-judgmental conversation between parents and children about what cannabis is, how it can be used safely, and why there are restrictions around use in people that are under the age of 18.
Good.
Another question. Ms. Shuhendler, if I heard your evidence correctly, you said that the criminalization approach to cannabis has negative consequences. Is that correct? Did I hear your evidence correctly?
We were speaking specifically to criminalization for youth, but yes. Yeah.
So does it have negative consequences for youth, the criminalized approach?
Yes.
So you're probably aware that C45 retains a criminalized approach.
Yes.
It'll continue to criminalize possession over 30 grams, cultivation over 4 plants, selling. A 20-year-old selling to a 17-year-old would face potentially up to 14 years in prison. Will that approach continue negative consequences on youth, in your view?
I think that's an excellent question. I think for the purpose of our brief and the surveying of our nurses across the country, we wanted to focus on the disproportionate disadvantage for decriminalizing for youth, and did not dive further into the excellent points that you raised that we heard addressed earlier a few days ago by this panel. But I think that a criminalized approach can be dangerous, and that the role of nurses in this is really to focus on providing an open space for education, and so the move towards legalization is definitely a way to do that.
Right. Thank you.
I'd like to get the advice or the thoughts of others as well with regard to home cultivation.
Related to homegrown, I just wanted to share some research. We've done a national survey of people that are using cannabis for medical purposes, and there's been an overwhelming sense that people that have been exposed to self-production prefer that as a route for their medical use. One, because they have control over the product. Many of them are quite good amateur botanists in terms of developing a product that is able to address the symptoms or health conditions that they're using it for. It also allows them to have ready access to their medication versus waiting for it through the mail system that currently exists. And again, it goes back to my point of the importance of regulating home grows so that we ensure the safety, not only for the people within the home, but for their neighbors and for the larger community. I also wanted to have a quick comment to your comment around hyperemesis syndrome. I just wanted to point out that the illegal status of cannabis has made it very difficult as a researcher to actually conduct research on cannabis. In order to actually do a clinical trial of cannabis, it can take up to 2 to 3 years in order to gain approval through Health Canada to gain access to the actual substance. So many of us in the research community are quite excited by legalization because it will hopefully open the door to the much needed research that needs to take place.
Interesting.
Did you have one?
Just very, very quickly, I've done research, qualitative research, where I've interviewed individuals, as well as my PhD student, Riel Kapler, across Canada in terms of their use of medical cannabis and their access experiences. And I know it may not be 100% related. However, we do believe that many people that use non-medical cannabis are actually using it for medical purposes. And in talking to those Canadians, number one, they want to bring cannabis use out of the shadows and be able to talk about it with informed, non-judgmental health professionals. They're open to education about cannabis risks as well as their benefits. They want reasonable access to cannabis, both within their communities as well as through their health professionals. They want choice in cannabis in terms of the strains, the products, the mode of administration, and access points. They want their experiences related to cannabis and their beliefs to be respected, and they all recognize that stigma associated with cannabis use is incredibly damaging to open conversations about their substance use.
Okay, thanks very much, and I really very much want to thank the panelists today. We've had some excellent panelists all the way through this, but you've brought a lot of new information and perspective to us. We appreciate all the different envisions, ideas, and proposals that you brought to the table, and they will all be considered. So I want to thank you all very much again for participating.